All right, hello, my name is Antonio Vargas. I am a student in Kin 241, and this is my Lab 1. All right, so I'm going to be going ahead and performing the lab on this pillow that I have here, and we're going to be starting off the skill sheet by looking at our primary survey. So the first thing we want to go ahead and do is to form a general impression of the patient's conditions, including anything like severe life-threatening bleeding. And then we also want to check for level of consciousness, right? So we'd want to use our AVPU, which stands for alert, verbal, painful, and then also unresponsive. Moving on, we could also check our ABCs, or the patient's ABCs, which would be their airways, breathing, and circulation. Now, if the patient were to be unconscious, we would want to make sure to open the airways and listen for any breathing, and we would also want to check their pulse, right? So we go ahead, open the airway, we want to take a look, we want to go ahead and listen, and then after we go ahead and check for a pulse. Now, if a patient were to be conscious, there's a little bit of different things that we would go ahead and do. Starting off, we'd want to check respirations for rate, rhythms, and quality of breathing. Now, with that being said, you also want to look, listen, and feel for breathing as well. So once again, we're going to look, listen, and feel for breathing. Now, we'd also want to look for the rise and fall of a patient's chest or abdomen while doing so. So making sure that they're inhaling and exhaling is basically what that rise and fall is going to indicate. Now, aside from looking at it, you also want to listen for it, right? So looking and listening for inhales and exhales. Now, from there, we would want to go ahead and then count the number of times that a patient breathes within 30 seconds. Now, we would then take that number and multiply it by 2. And then this would be the number of breaths per minute that the patient is currently breathing. And we would want to go ahead and record our findings for that. Moving on, we would then place 2 of our fingers on top of a major artery or pulse, right? So a couple of these pulse points could include the carotid arteries of the neck. They could also include the radial artery of the wrist here that you would find. And then also for infants, you can look at the brachial artery, which is on the inside of that upper arm, right? So per se, if we wanted to check this patient, let's say maybe their carotid artery here on the neck, checking for that pulse, right? Perfect. Next, in order to check one's pulse rate, we want to count the number of beats in 30 seconds and then multiply that number by 2. Following that, we would go ahead and we would record our findings. Now, another thing we want to go ahead and check for would be the patient's skin characteristics, right? How do they look? How do they feel, right? So we want to go ahead and check for those things. So color is a big thing. And color, we want to make sure and see if the patient is pale, right? Or if they're ashen, or maybe if their skin is a little pink or flushed, right? So paying attention to that sense in terms of skin color. We'd also want to look at temperature, right? Do they feel hot? Do they feel cold? Again, moisture is also another thing that's pretty important. Are they moist, right? Are they dry? Are they sweating? Are they perspirating? Anything like that. Again, moving on, we then want to look at our capillary refill test, right? Is it normal or is it slow, right? And so that capillary refill is basically when you go ahead and you apply a little bit of pressure down on the fingernail and you see the blood go ahead and rush back. You want to make sure that that's rushing in at least 2 seconds. So you want to make sure if that's normal or if it's not in this case. Now, we would also want to go ahead and record our findings for all of this information that we just gathered. So moving on from that primary survey, we want to go ahead and start off with our secondary surveys, more specifically looking at sample history, right? So sample history, what does that mean? Sample, or S, starts off with signs and symptoms. You then have A, which are your allergies, M, medications, P, which are going to be for pertinent medical history, and then last oral intake, and finally the events leading up to the injury itself. So we're going to start off with signs and symptoms, right? So signs would include anything like bleeding, also hearing breathing distress, right? So if a patient's having a hard time breathing would be another thing. If a patient feels cool or moist, right? Symptoms, on the other hand, could include things like pain, nausea, headaches, anything like that, or even difficulty breathing. So furthermore, we would then look at allergies next, which is the A in samples. Allergies, we want to determine if the patient is allergic to any medications at all, food, environmental things such as elements as pollen or even things like bees, right? So those are all things that we want to take into consideration when it comes to looking at allergies. Moving on, we then want to look at medications, right? So making sure to determine if the patient themselves is currently or presently using any form of medication, right? And then we want to make sure that we go ahead and record any of the medications, prescriptions, or even non-prescriptions that they're taking. So from there, we then have pertinent medical history, right? So you want to determine if the patient is under any kind of healthcare provider, any kind of care for any condition that they may already have before you even got to them, right? Because they could have a similar problem that they may have, experienced in the past, or for example, they could have been recently hospitalized, which is another thing that you want to be asking for when going through your sample history. Now, moving on, second to last is that last oral intake, right? So you want to make sure, did the person, or when was the last time that a person had a solid or a liquid, right? Checking to make sure that would include food, fluids, or any kind of medication, anything that the person ingested. You definitely want to know that kind of information. Now, we would then want to go into the events that led up to the incident or the injury that took place, right? So you want to determine what the patient was doing before and at the time of the incident itself, just so that you can go ahead and further evaluate the injury itself. All right, moving on, we're now going to be moving to the secondary survey, more specifically looking at our physical examination. So we want to be using the mnemonic DOTS, right? And DOT stands for deformity, open injuries, tenderness, and also swelling. So when going through this, we're going to perform a physical examination beginning from the head and neck, right? So you want to go ahead, look at the pupils, right? See if they're either pearl, right? And pupils means, or pearl in this sense is going to stand for pupils equals to reactive to light. So we obviously want to make sure that those are the same. And then we're also going to be going ahead and checking for any fluids, seeing if there's any leaking from the ears or the nose, or that could be an indication of a leakage of cerebral spinal fluid, right? So we're going to go ahead, check the head. We're going to be checking for any of those fluids that we might see that might be an indication of that cerebral spinal fluid. All right, next we're going to be looking at the shoulders, right? The shoulders and the chest. So you also want to be looking to make sure that there is, or looking for rather, a deviated trachea, which could be inducing or indicating rather a punctured lung, right? So we're going to be going ahead, looking for the trachea, seeing if anything is wrong there. And then moving on, we also have the patient's breath, right? So you want to check and make sure to check the patient's breathing, right? So they're going to go ahead, they're going to breathe out, and then they're going to breathe and hold also while you squeeze the rib cage, right? So they're going to breathe in, breathe out, squeeze the rib cage, checking for any pain, right? Pain or crepitus, which is that grinding sound, right? So you're going to go ahead, once again, have them go ahead and take a deep breath out, breathe in and hold, and then you're going to go ahead and compress that rib cage just slightly, just to see if there's any chest pain, or again, once like how I said, any crepitus. All right, moving on, we are then going to be checking the abdomen, right? So we want to palpate the 4 quadrants of the abdomen, starting off kind of using that belly button as a center point. We're going to go ahead and palpate, making sure that we can see if there's any pain or discomfort. Making sure to press deeply as well is also important here. Perfect. So then now, if it is painful, we are going to want to go ahead and redo the 4 abdominal quadrant palpation. The difference is this time is we want to let go rapidly, right? So then this is called our rebound test. So when we go ahead and let go rapidly, right, the patient will feel pain, right, with the deep palpation. But then, like how I said, an instant amount of relief once you go ahead and you take off that hand, with the more rapid response. All right, next, we are going to want to be checking the pelvis, right? So pelvis down here, looking at the waist. We're going to be making sure to check, to see the sides of the pelvis and the femoral greater trochanter squeeze. And then we should also be making sure that the pelvis, we're squeezing it together, right? From both sides, looking for any kind of pain, right? So we're squeezing the pelvis, making sure that there's any kind of pain on either side. Now, moving on, we can also look for any incontinence here as well. That's also one thing that you should be, checking for before moving on to the next part, which would be the legs and the feet, right? So For the purpose of this, I'm just going to move this a little bit forward. Normally, you wouldn't want to move a patient under any circumstance unless it's an immediate emergency. But in this case, I'm going to go ahead and show you that we're going to be checking the legs and the feet here. So we want to be looking at that capillary refill again, right? So kind of like how I showed you before, you're checking the nails, making sure that the blood comes back in at least 2 seconds, right? And then we also want to go ahead and check here. I want to make sure that we have access, both legs, that they feel the same sensory neurologically, right? The same kind of senses on each side, making sure that they're both kind of symmetrical in that sense. All right, then we can move on to checking the arms and the hands. So again, similarly, we're going to be looking at that capillary refill, looking at the toenails or the fingernails themselves, especially to see if the bed of the toenail is injured at all, just to make sure and see if one side is different from the other. Moving on, we can also check the patient's back by rolling them onto their side, right? So we're gonna roll them onto their side. We'll have their knees bent nice and easy, and then leave them in a side-lying recovery position. Alrighty, and that is it.